we have a short session of only 1 hour today. So in that case, I'm going to jump in by starting to share my screen. All right. Okay, here we are. So let's get started today. Welcome, everybody. Thank you so much for taking the time to join us. My name is Nanine, and I am the Managing Director at the Physicians Association for Nutrition, or PAN International. We are a global medical nonprofit organization advancing nutrition in health systems for the benefit of people and the planet, ultimately working to reduce diet-related deaths worldwide. I am delighted to be your host and moderator of today's session, the Planetary Health Briefing for Global Health Professionals. With more than 10,000 citations and over 600 policy references, the original EAT-Lancet Commission outlining the Planetary Health Diet for the first time has become one of the most influential scientific reports in the world. It helped define clear targets for healthy diets from sustainable food systems, shaping policies, research agendas, and public action across sectors. And just 1 month ago, we celebrated the publication of the updated 2025 EAT-Lancet Commission on healthy, sustainable, and just food systems, building on a legacy with stronger scientific foundations and a renewed call to action. PAN International is proud to have supported the launch through our role as co-host of the Healthcare Professionals Community for Action. And we are now focused on translating this global science into tools for use within the health sector. Today's webinar is designed to unpack what the updated Planetary Health Diet means for those working in clinical care, public health, food service, and policy. We'll introduce our new action brief for healthcare professionals, developed in collaboration with EAT and over 70 organizations worldwide. Some of you may be in the chat today. And we will explore practical ways to apply this knowledge in real-world settings. So now I would like to introduce our esteemed panelists. Firstly, Professor Walter Willett. Professor Willett is a physician and epidemiologist and currently serves as Professor of Epidemiology and Nutrition at the Harvard School of Public Health. He is one of the world's most cited nutritional scientists and has published over 2,200 research papers on diet, heart disease, and cancer. He chaired Harvard's Department of Nutrition for 25 years and helped lead some of the largest and longest-running cohort studies on diet and health. Professor Willett is a member of the U.S. National Academy of Medicine and has received numerous international awards for his contributions to public health. Thank you so much for joining us, Professor. And now I'll move on to the PAN International team. Thank you. I will hand it over to you in a second. Just to continue introducing the PAN International team, firstly, Dr. Roberta Alessandrini. Dr. Alessandrini is a dietitian and global health nutritionist. She is the director of the Dietary Guidelines Initiative at PAN International, where she leads efforts to make dietary guidelines worldwide more evidence-based, environmentally sustainable, and inclusive. She holds a PhD in public health nutrition from Queen Mary University of London, and her research focuses on the nutritional aspects of alternative proteins. Dr. Alessandrini brings a wealth of experience across academia, policy, NGOs, and community nutrition, combining scientific expertise with practical experience as a nutrition educator to drive real-world impact. And last but not least, Sumati Bajaj. Sumati is a nutrition policy researcher with expertise at the intersection of diet, health, and sustainability. She has worked at the University College London and the International Food Policy Research Institute, contributing to peer-reviewed research, policy briefs, and scenario modeling. Sumati holds a master's in development studies and is a contributing author to the 2025 EAT-Lancet Commission report. At PAN International, she works to bridge science and policy through tools that support healthier, more sustainable food systems. And those are some really impressive and awesome bios. I look forward to receiving some of your questions for our panelists, which we will address at the end. And now I would love to hand it over to you, Professor Willett.
Yes, I just going to switch on my screen sharing here just a second. And I'm really happy that everyone is joining today. And there, I think we're ready to go. I'm especially grateful for everyone who joined because, in fact, you are the people who are going to translate this work that we conducted over 3 years into meaningful action. And that's absolutely critical. And I can't underdescribe the urgency of this situation. I think you know why you're here, and I don't have to go into that in great detail. You already heard a quick background. This is building on the 2019 report of the EAT-Lancet Commission. But it was very clear that anyone would want to have the best up-to-date information going forward. And so shortly after the publication of the 2019 report, we started planning the 2025 report to update information and also expand several sectors that I talked about. The challenge that we were given, and it's still a challenge, how to feed what will be about 9.8 billion people in 2050, a diet that is healthy and sustainable. And we added just more explicitly this time. We reviewed, and I'm going to emphasize the diet and health part of the report, given I think the interest and expertise of this audience. I'll talk about that primarily, and then go on and mention very briefly some of the other components of the report. We used looking at the question of what is a healthy diet, and that was a critical starting point. Layers of evidence, the composition of food, effects from randomized trials on risk factors of different dietary components, associations with disease in large cohort studies, and where we had them, randomized trials. And of course, those were relatively few. Just as a quick example here, looking at major protein sources and the PS ratio, which we've known for a long time is related to blood cholesterol and ultimately cardiovascular disease. I think most of you are aware that milk, beef, pork have large amounts of saturated fat. What many people don't appreciate is that they have, especially milk and dairy, very little polyunsaturated fat, which is essential. And that's really just as important as the larger amounts of saturated fat. Salmon, poultry, fish in general have better PS ratios. But if we really want to go to high PS ratios, that means plant sources of protein. The next level of evidence we looked at was, again, randomized trials with risk factors as outcomes. This is from a meta-analysis that was published after our 2019 report, about 24 randomized trials. And as you might expect from what I just showed, moving from nuts, legumes, soy products to red meat increases LDL cholesterol. No big surprise. What's really important, though, here, and I want to emphasize, is specifying the comparison. If we looked in this meta-analysis just at red meat compared to the rest of the diet, which is done in quite a few studies, it doesn't look too bad. But I think most people know the rest of the diet is usually not very healthy. So that would mean that red meat is about as bad as the rest of typical diets. But the comparison with plant sources of protein is where you really see the benefit. We also use quite a bit of information from large cohort studies because it's very difficult to do randomized trials looking at hard endpoints, looking at specific dietary factors in hard endpoints for all the practical reasons you can understand. These are our 3 major cohorts, and they are fairly unique because they have repeated measurements over long periods of time, over 3 decades now. This is what we saw in our large cohort studies. As an example, major protein sources at 3% of energy from protein in relation to total mortality. This was about 30 years of follow-up, about 30,000 deaths during this follow-up period. Not surprisingly, over on the right, processed meat was the worst. Non-processed meat, a little bit worse than dairy, the reference food here. But if you really wanted to go to low mortality, plant sources of protein would be the best option here, as you can see, fitting with the other layers of evidence. So that gave us quite strong confidence with these multiple layers of evidence that shifting toward more plant sources of protein as opposed to red meat and even with dairy foods would be better. But there's also a question of how much. And we're not saying in our report that we need to totally eliminate red meat. There's, like I think most things, small to modest amount probably has low risk, although you could say, because when we looked at the dose-response relationship, that there's no safe amount. This is looking at red meat and type 2 diabetes. But the risk would be very low if you had about 1 serving per week. We can't say it's zero risk, but the risk would be small at that level of intake. Type of fat is very important, one of the most important factors. And here, this is again looking at total mortality in our large cohort studies. Trans fat, the worst, saturated fat compared to carbohydrate being modestly related to a higher risk of overall death. But what was really most striking here is very strong inverse association with polyunsaturated fat, which mostly comes, in fact, almost entirely in our diet from plant sources. This is our Planetary Health Diet, as we ultimately called it, from the 2019 report. And just very quickly, and this is, I think, familiar to most of you already, we emphasized whole grains over potatoes here, but again, not excluding anything, plenty of fruits and vegetables. Dairy is especially complicated because there is nutritional benefit there, but also at higher intake, some adverse outcomes. And our target we set at 1 serving a day of milk or milk equivalents. Again, for red meat, equivalent to about 1 hamburger per week, about 2 servings of poultry per week, 2 eggs per week, 2 servings of fish per week. And the omega-3 fatty acids are clearly essential. They don't have to come from animal sources, but fish and seafood is a good source. And emphasizing, though, plant sources of protein and a variety of plant sources of protein, and emphasizing unsaturated sources of added fat. Now, that's a lot of numbers. After we published the report, I realized it boils down to something really pretty simple. First of all, the ranges did include 0 for the animal sources of protein, and we did have a version of a vegan diet or lacto-ovo vegetarian diet. So we tried to create the biggest possible tent and variety for options for people. And that's, I think, really important, not one narrowly defined healthy diet. But this flexitarian version, after all those numbers came down, putting them together, it came down to 1 + 1. And I find that really simple to convey, and in fact, simple for planning my own meals during the week. That means about 1 serving of dairy per day, and 1 serving of another animal sources of protein, keeping red meat, though, about not more than once per week if you want it, eggs, and that's or poultry or fish, about 1 other serving per day. And of course, that's on a base of nuts, soy, beans, other beans, fruit, vegetables, whole grains, and healthy sources of fat. This is the plate that we published the first time, emphasizing in a pictorial way what I just described. In terms of randomized trials, it's very interesting that the Planetary Health Diet was really a good description of the traditional Mediterranean diet. And that has been shown in a major randomized trial, the Epidemiology study from Spain, that this does reduce cardiovascular disease incidence. And that's either with added nuts or added extra virgin olive oil in that particular example. So for this overall dietary pattern, we really did have all 4 layers of evidence that combine to give us high confidence that the direction that we described is a healthy direction. Since the publication in 2019. There has been a lot of other information, but it's basically supported what we published then. This is an example of an update looking at red meat and type 2 diabetes. Now there are over 22,000 cases in our large cohort studies. We used some measurement error corrections, and that strengthened the association. If anything, it would have pointed to a little bit lower red meat intake than we described before, but it wasn't very different, so we didn't really change that. We also looked very specifically at the question of potatoes versus whole grains. You can imagine the potato industry was not terribly happy with what we said, but we didn't exclude potatoes. And this shows very clearly in the substitution analysis, which these substitution analyses with direct comparisons are really important. And we emphasize those in our report. But substituting whole grains for potatoes, there was a very clear inverse association with type 2 diabetes risk. And that was seen whether the potatoes were boiled, fried, or whatever. When we put all the updated information together, again, we basically decided we didn't need to change the Planetary Health Diet description very much. We rearranged the table a little bit to hopefully to make it a little bit clearer here, emphasizing here plant sources as an overall group versus animal sources as an overall group. The total energy was just slightly less, different sources of data, but basically no material difference with the updated description of what we've called the Planetary Health Diet. We came out with a more colorful version of the plate, but again, it's really no substantially different description of the overall diet. What we did have that was new since the first publication was literature on the relationship between the whole dietary pattern. We did create a score based on the table of the Planetary Health Diet description, and then we could look at that score indicating adherence, degree of adherence to the Planetary Health Diet in relation to many different outcomes. This is in relation to total mortality in our large cohorts. At this time, about 54,000 participants had died. This is women, and 2 points here are really clear. Most importantly, it's not all or nothing that every step closer toward a Planetary Health Diet was related to lower mortality. That's women, and this is men, basically the same pattern. And for the top versus bottom, 10%, about a 30% lower risk of overall death. So very major health benefits. And for several reasons, that's probably an underestimate, almost certainly an underestimate. We, like last time, looked at the gaps globally between the Planetary Health Diet target numbers and what's actually consumed around the world. Whole grains underconsumed almost everywhere. Root vegetables, excessive intake in parts of Africa, mainly because of poverty. This is mostly cassava. Fruits and vegetables being low almost everywhere. Red meat being quite overconsumed in the US and Europe, but parts of the world actually were below the Planetary Health Diet number. This is Southeast Asia. But what's notable here is underconsumption of healthy foods in most places, but a huge variability around the world. We then went on to look at the question of how much mortality might we prevent on a global basis if everyone would shift to the Planetary Health Diet target numbers. And we used data that was put together by Marco Springman to develop a map of the degree of adherence, basically the Planetary Health Diet score for almost all the countries around the world. And then we could calculate from the relative risks I described there from our large cohorts, plus the global map here, looking at current diets. And we could calculate that if we did shift to a score of about 120 out of 140 for adherence, we didn't say that people had to be perfect, but this is a pretty good score. That would prevent about 15 million premature deaths per year, which is about 27% of adult deaths. These are just adult deaths. We didn't think we had the adequate data to look at child deaths because of the complex interaction with infectious diseases. We have the data online for each country. That's about 30% of deaths in the US. We have a little bit less healthy diet than average. Other countries like Greece, it was a smaller number, about 25%, because diets were already on the healthier side. A large part of the report relates to modeling. We had 11 international modeling groups looking at the potential for reducing impacts on dietary boundaries or environmental footprints of the adherence to the Planetary Health Diet. And like last time, the modeling basically looked at three major pillars to reduce environmental impacts or limit environmental impacts. Adoption of the Planetary Health Diet, reduction of food loss and waste, and then carbon neutral, sustainable intensification of agriculture. And it was really important that we had a lot of agricultural expertise on the panel. And this meant shifting to green sources of energy, precision agriculture, closing yield gaps from around the world, and not expanding land for agriculture, which is really critical, basically to stop cutting down forests to grow corn and soy to feed to animals or for grazing. This is a summary of the modeling group work. There's about 100 pages of detail in the report and supplements on this. It's a pretty heavy reading, I must acknowledge. But if we follow the track we're on toward 2050, this is what would result. This is what's called a business as usual model: increasing land for agriculture, substantial increase in greenhouse gas emissions from the food sector, more water use, more nitrogen use, more phosphorus uses, fertilizers, clearly on an unsustainable track. But if we adopted that package of healthier diets, Planetary Health Diet, reduction of food loss and waste, and better agricultural methods, we could actually reduce land use. And this is really important. Substantially reduce greenhouse gas emissions from the food sector. We still would have a little bit of increase in water use and some increase in fertilizer use. So some additional approaches would need to be invoked there. We, as I mentioned, added a major section on justice, and I won't go into that now, but just to point out that most of the, basically the climate change crisis has been caused by the North American and European behaviors of using large amounts of fossil fuels, and about 30% of the greenhouse gas emissions do come from the food sector. And so we're basically using up much more of our fair share of greenhouse gas emissions, both from greenhouse gases, from fossil fuel consumption, and from the diets that we're presently consuming that are heavy on animal-sourced foods. And the rest of the world is saying that's not fair. And this is a map looking at the proportion of the population we expect by about 2050, and the distribution of impacts is much greater from this part of the world, and so the changes really mostly need to be made there. Although, of course, China with its large population and India are starting to have some major impacts. Interestingly, China's really doing a lot about that. We also, in our report, tried to emphasize that the Planetary Health Diet can be implemented in diets from around the world. The Mediterranean diet is best studied. We have the strongest data there, but the same dietary pattern can be implemented with other flavors, with other foods. That was the Mediterranean diet. This is from Vietnam here, of course, tofu being an example of a plant source protein. This is from West Africa, some really wonderful, tasty, enjoyable foods there, Costa Rica, and virtually, in most countries, the traditional diets are very close to the Planetary Health Diet. So we did estimate that we could feed close to 10 billion people a healthy diet within safe planetary boundaries, but this does also mean going to almost zero use of fossil fuels, and this is not going to be easy. It will take the efforts of almost everyone. we have a whole section on action, and we're counting on everybody who's on the call on this session this morning to be part of this. And I just put this table together a few years ago, pointing out that we can have action from the global level down to the individual level and everything in between, and through every sector, whether it be schools, healthcare, work sites, or food environment, built environment, mass media, research and evaluation, and the economic sector. No matter where you are, there is a place for your impact, and we really desperately need it. This is really important, and I again can't underemphasize the urgency of the changes that we need to make. Thank you.
Thank you so much, Professor Willett, for unpacking the Planetary Health Diet and some of the evidence that went into the report. I am going to hand over to Roberta, but as I do that, I will share my screen. We did get a question in the Q&A box, is it possible to still get a hard copy of the report? I wonder if I can squeeze that question in there while I find my screen sharing.
If you go to the EAT-Lancet, the EAT website, and I think that URL can be put up somewhere, you can get a version to download. The number of hard copies printed, I think, is still fairly limited. That's a world that I grew up with, but it hardly exists anymore. But it's all there on the EAT Foundation website for free.
Fantastic. We are now in the digital era. So Alvira, who's doing some of our chat support, maybe you can find the link for the people to download and access. And in the meantime, I will hand it over to Roberta.
Hello, good morning, good afternoon, good evening, everyone, and thank you very much for joining. So today I will be telling you what we have been doing at PAN to implement the Planetary Health Diet. As Professor Willett said, there is an urgency really to act. So we created, together with our colleagues at EAT and Convene, an amazing community of healthcare professionals, 70 healthcare professionals coming from 50 organizations from all around the world, to hear the views about what should be done to implement the Planetary Health Diet into all aspects of our society. So we engaged all these fantastic colleagues, and I can see that a lot are here in the call today, in 3 online dialogues and 1 in-person event, which happened in Stockholm the day before the Stockholm Food Forum. And you can see the pictures below. And so we gathered together and developed this fantastic resource, which is the action brief for and with healthcare professionals. And Nanine, can you pass to the next slide, please? So this brief has 10 calls to action. And with these calls, we try really our best to implement the Planetary Health Diet into healthcare. So I'm going to tell you a little bit about the calls of action. So the first call of action is really the promotion of the role of sustainable diets as a healthy diet that are able to treat and prevent disease. The second call to action is the recognition of the importance of dietitians and nutritionists in the whole healthcare workforce. We should work more closely together with our colleagues, medical doctors colleagues, with our nurses colleagues, to help patients and communities to change their diets towards more healthy and sustainable patterns. We also need to embed nutrition in the training of medical doctors. This might seem obvious, but many doctors worldwide do not study nutrition in their training. But nutrition is so important to prevent disease, so we must change this. We also need to make sure that dietitians and nutritionists learn about sustainable nutrition in their training. Yes, this is very important. And when I did study dietetics, I was not taught about sustainable nutrition. We should also reorient a system towards prevention, and nutrition is such an important part of that. And also, we need to leverage our trusted voice. People and citizens trust a lot healthcare professionals, so we should use our voice to drive change at community level, at policy level, with individuals. We have really a great opportunity here. With patients, we should really communicate with clear and actionable advice. I am talking about, providing, asking simple questions like, have you eaten your 5 portions of fruit and vegetables every day? And how can we help you to achieve that? And if, we need to also be quite adaptable and meet people where they are. And if they are not eating any fruit and vegetables, we should propose including at least 1 portion per day and move forward. We should also use behavioral strategies as much as possible. There are some moments in life where it's easier to change behaviors. For example, when you become a parent, you want to be healthier, and it's easier for people to shift to healthier and more sustainable diets in these moments. As well as when you have a diagnosis, for example, you've been diagnosed with diabetes, we should leverage this moment to get people to get healthier and eat a better diet. I think it's very important, and I do not think it myself, but our community of action thought it, that it's very important to assess people nutritionally and understand their life circumstances. For some people, accessing fresh produce is really a luxury. So we need to understand this, because they might not have the financial means to access those products, or maybe because they don't have time to go and shop for fruit and vegetables and prepare these foods. We should also promote culturally relevant foods, because as Professor Willett said, the Planetary Health Diet is not a monolithic prescription. It's really adaptable to a variety of context and culinary traditions. Plus, a healthy and sustainable and just diet can be so delicious and tasty and colorful, and we should always mention this and include this information when convincing our patients, policymakers, to implement the Planetary Health Diet in a variety of settings or in individual behaviors. We should also use community settings as much as possible. And here is included twice because it's very important, because communities is where we live. So we should take advantage of initiatives happening at the community levels, happening in schools, happening in faith-based organizations and settings to promote as much as possible the Planetary Health Diet through education, through cooking demonstrations and food gardens, and in a very practical way, as much as possible. So, Menin, can you go to the next slides, please? Together with the 10 call to actions, we also developed some and thought about some actions that we should be stopping. So, for example, there is this idea that the Planetary Health Diet can address only problems relating to overconsumption, but we've seen with evidence that the Planetary Health Diet can address both overconsumption and underconsumption, so overnutrition and malnutrition at the same time. And there is more to find out in our action brief. And you can find a preview of our action brief here, and you can find also a QR code, so you can scan the QR code and access the full action brief. The action brief also includes how we can work with other sectors to implement the Planetary Health Diet and unlock the food system transformation that we hope to see happening soon. For example, we can work with policymakers to make more sustainable food-based dietary guidelines aligned with the Planetary Health Diet. And the action brief also includes more than 40 stories of progress, of projects, initiatives that are happening all around the world. And all these amazing initiatives are really about implementing the Planetary Health Diet into a variety of settings and in many different ways. And PAN is also, of course, doing some of this work. We have some projects. We have the Green Food Experience, in which we provide some help to get student medical doctors to organize food tasting sessions on their campuses so that future doctors can learn about healthy and sustainable diets. We also have another program called Healthy Hospital Foods to help improve hospital foods, because in many countries and settings, this is not always appealing and tasty. So we want to change that to offer and design meals with chefs working in hospitals that are that promote health, recovery, and that are sustainable. And then there is my project, the Dietary Guidelines Initiative, that is a project that aims to change guidelines, food-based dietary guidelines at national level to make them more aligned with the Planetary Health Diet. So if you want some information about this, you can get in touch with me, and I know that my colleague Elvira will put some information about this project in the chat soon. Next slide, please. So now we build this amazing community. We are here all together, and we want to do more and to really drive change. So what we ask you to do is really to read the action brief, to download it, and to use it as much as possible at events, meetings, like the multidisciplinary meetings that you have with your colleagues in hospitals, in the newsletters of your organizations, in professional WhatsApp groups or LinkedIn groups to inspire action. And we also want this action brief to be used as much as possible to drive change at policy level. And please try to adapt it to the local context as much as possible. But we can help you with this. We are happy for you to join our healthcare community for action. And if you want more information, please do get in touch with myself or with my colleagues, Madi Bajaj. And that's all from me today. Thank you.
All right, so now we're going to get even more specific about how we will be putting this into practice by sharing a new resource, which is our physician fact sheet for the Planetary Health Diet. And now I will hand over to Sumati.
Thanks, Nanine, and thanks, Walter and Roberta, for your excellent presentations. I would just like to jump right in and say that while the Commission developed this massive body of evidence and scientific work, we at PAN here are more of a translator, where we, with this fact sheet, have translated everything that Walter presented in those dense and very scientific slides into very short summaries on what the evidence says on every food group and health outcome, and giving very practical recommendations of serving sizes for each food group and how food substitutions can be made for each dietary preferences. So basically, a resource which the healthcare community can use in their daily practice for obviously our own lives, but also in their recommendations and in their clinical practice. Along with that, we also highlight what the impact of the PhD would be on the nutritional status and for which key nutrients we should be monitoring and what the next steps for those nutrients can be. But overall, just like a good resource, a handy resource, not just for you to know how you can use it in your clinical practice, but also gives a base of reasoning that you can provide to your patients on why should we be more plant-based or why should there be less processed foods. And you will have a link of the physician fact sheet in the chat. We do have, so I think you can access the physician fact sheet on our online platform that's called PANCO, which also has other nutrition and health related evidence, more information, and gives space to collaborate and network within this community. We also at PAN have developed a couple of other resources. Nanine, could you go to the next slide? Basically, we have this web page where we have compiled all the resources. So if you just scan the QR code, you will get access to the fact sheet, the action brief, and few more summaries of the report. Apart from that, we also have, by we, I mean the commission, the EAT-Lancet Commission also has some really nice, cool PhD meal plan recipes and with its nutritional analysis coming up on the EAT website, not yet, but soon, which again would be a great resource, not just for our own private practice, but also for patients and the healthcare sector. I think that's all from me. We can jump right into the Q&A.
All right, thank you so much. I'm really excited about our practical fact sheet. I hope that we're able to take some of the really interesting and in-depth science and translate it into your practice. So that is what we aim to do with our fact sheet, and I hope that you can find it on Panco alongside our other free resources. And I'd like to thank all the panelists for being so concise, because we have managed to save a decent amount of time for Q&A, which is where everybody over here gets to interact with our panelists. So thank you for submitting your questions. I'm just going to dive right in. So I think, Walter, I'm going to direct this question towards you, and it is about egg consumption. So one of the hallmarks of the Planetary Health Diet is how plant forward it is. And so this question here is, why limit egg consumption so strictly? Several recommendations go as high as 7 eggs per week. So could you tell us a little bit more about that?
Right. Good question. And first of all, I do want to emphasize there, and I couldn't show it on the screen. If you look at our table there with a description of the Planetary Health Diet, there's a big section of footnotes below it about trade-offs or exchangeability there. Particularly if someone's not consuming dairy or red meat, you could exchange some of that for more egg consumption if you wanted to, and could have an egg a day if you're not eating some of the red meat or some of the other animal sources of protein there. But then again, this is about comparisons, and it's when we look at the literature on egg consumption overall, if you just look at, without any more detail, look at egg consumption, it doesn't seem to be, it looks almost neutral. It doesn't seem to be related to increased risk or increased or decreased risk of major outcomes, cardiovascular disease. But if you compare egg consumption to plant sources of protein, such as nuts and legumes, then there would be lower risk. So, for example, for breakfast, one option would be to have an egg or two on most days. But if you have whole grains and nuts, that would be even better. So again, it's really that kind of contrast that led us to be moderate in terms of egg consumption. 2 eggs per week was, for many years, the recommended level from the American Heart Association, for example. And I think that's, looking at the big picture and comparison to other food groups, that's reasonable. But again, for some people, eggs may be more affordable and available than, say, meat or something else, and the consumption could be higher.
Thank you so much. And I am going to stay on the topic of food groups. And there is reference to some cohort studies. So I'll just read the question. Research suggesting that even small amounts may be linked to higher risk of certain chronic diseases. For example, Adventist Health Study found that vegan participants had lower BMI, blood pressure, and diabetes prevalence than semi-vegetarians or pescatarians. The EPIC Oxford cohort showed that lower or no animal product consumption was associated with reduced ischemic heart disease, and T. Colin Campbell's work in the China study suggests a dose-response link between animal protein intake and markers of chronic disease risk. Could you help me understand your rationale for recommending some animal products in light of these findings?
Right. We did look at this. I think when you get down to quite low animal product consumption, like 2 servings a day, we really can't, with our data, distinguish that from zero. The Oxford study did show actually the pescatarians did a little bit better, if anything, as I remember, in terms of cardiovascular mortality. And the strict vegans were really pretty similar, I think, statistically not very different than other vegetarian groups that did allow a modest amount of animal source protein there. So it's like ionizing radiation or something like that. When you get down to quite low amounts, it's very difficult to distinguish zero from a small from modest or small amount of consumption. I think it is important to point out that if somebody is going below about 2 servings a day of animal source foods, it's very likely that you will become B12 deficient, and that has serious neurologic complications. So if you are going less than 2 servings a day, you really will need to have supplementation, supplements, or use of fortified food. So again, we're trying to maximize flexibility, and I think we're not. To be honest, I don't think we can really make a clear distinction between being strictly vegan and a healthy vegan diet, because there's lots of unhealthy vegan diets too, or really poverty diets. But it looks like you can be quite healthy with a healthy vegan diet or small amounts of animal source protein, like we indicated here. And I think it is really important to again, make the tent as big as possible here, to not say it's all or nothing, or else we're going to end up with only a very small portion of the population aboard. I have looked in detail at Colin Campbell's data. I was actually on his advisory committee for a while, and his data don't really show what he says. It doesn't show that being a vegan is healthier.
Thank you for mentioning vitamin B12 as well. That is a very important topic that we often talk about, and you can find our guide to vitamin B12 supplementation alongside our free resources as well, if that's a topic that anybody is interested in. And I'm going to direct another question at Roberta, as a dietitian and somebody that works with many nutritionists and dietitians. We have an interesting question here. It is often said that 98% of scientists agree climate change is caused by human action. What percentage of nutritionists agree that the Planetary Health Diet is the right solution for health? What do you think? I'm sure you don't have a percentage number, but with your engagements with nutritionists and with dietitians and nutrition decision makers, how are they agreeing to the Planetary Health Diet?
Thank you,
Well,
Renee. This is. Oh,
go ahead.
Walter.
Oh, sorry. Yeah, go ahead. I was gonna. I'll say something after you.
Yes, thank you. That's an excellent question, because I think we are, us who interested in, healthy and sustainable diets. We work together quite a lot. We are in a bubble sometimes, right? But, out there are so many healthcare professionals, doctors, nutritionists who know nothing about, the planetary health diet. So we really should make an effort to talk more to these colleagues and engage them and show them the evidence that the climate crisis and the health crisis are so intertwined together, and we have a solution for this, which is healthy and sustainable and just diets, and the work that Walter and the Commission have been developing for years. So I don't have a percentage for this, but unfortunately, I think that we 100% agree among us, but outside there are so many people who don't. Yes. So Walter, would you like to add anything to this?
Okay. Yes, I agree that the planetary health diet's relatively new, but if you've instead say Mediterranean diet, which is much more familiar and an example of a planetary health diet. We don't want to compete, but in fact, the Mediterranean diet is because of the decades of research there, there's huge evidence that that is a healthy dietary pattern. And there's actually in the U.S., U.S. News and World Report runs a survey every year of what are the healthiest diets, and for 8 years in a row, among the dietitians, nutritionists who were surveyed, the Mediterranean diet has been the top 8 years running. And so if we just rename it, is that being one example? I can't put an exact percentage on there, but it would come to the top in terms of healthy dietary patterns. So it's really helpful to have that as an example, but again, you can put this together. I think the advantage of what we've done, we started in sort of building it from the base up, the component by component, piece by piece, and what we end up with is basically a description of the traditional Mediterranean diet. So the fact that coming at it from 2 different directions, the whole dietary pattern and thousands of years of tradition, well studied, and building it up piece by piece, we end up in the same place. I did want to mention Dr. Mehta's comment there, which is a good one. The reason it looks like we, in some parts, some countries, have an increase in water consumption and fertilizer use with the Planetary Health Diet. In India was an example that so many people are consuming unhealthy diets with very low consumption of fruits and vegetables and even legumes there, which are compared to just rice or just another major source of starch. You do need to have more inputs there, water and fertilizer, to actually increase production of these health promoting foods and fill those gaps. So the reality is, a healthy diet does require some resources and inputs, and going from a poverty diet to that will increase water consumption and fertilizer use. Not we're close to what could be sustainable there, but that means we have to work harder at some of the other things, such as even further reducing or limiting food loss and waste, and improving agricultural methods. I think a major conclusion is we need to invest a lot in agricultural research to use every square meter around the world in the best possible way to be as sustainable as possible. I also just want to add one little note that the description of where the health community can make an impact was really good. And I would encourage people to document and publish examples of where they've done something and maybe even where it failed. But what works and what doesn't work is really important, to share your experiences in a way that other people can learn from them. I know there's so many good things going on, but most of them are not documented, and that's a little bit lost opportunity where others could learn from your experience. So if possible, that's a really good thing to do.
Absolutely. I couldn't agree more. Us as health professionals in the chat should be the ones that are testing and measuring the planetary health diet among our patients and publishing that information. So that's a really good call to action. And while we're on the call to action and actions from our community, we have a question from Alana asking, are there any resources for engaging communities and starting community conversations on the planetary health diet? So there are a number of communities for action. And maybe, Roberta, can you tell us a little bit about the communities for action and how we can use the brief to engage the healthcare community specifically?
Yes, of course. Just to connect what Walter said about telling and showing other people what we are doing to implement and healthier and sustainable diets. I mentioned the stories of progress before. So if you go back to the Google site where the QR code that was in my slide, where the action brief is, you can find more than 40 stories of progress where our colleagues and partners have told us about what they are really doing to implement sustainable diets in a variety of settings. So we can really learn from each other, and as Walter said, we should also learn what hasn't worked, what is working, what is not working. So I'd encourage you to get in touch with us if you would like to have your story of progress to be included in the website and to be part of your community and to be included in our community. And Nadine, did you ask me another question, right?
Well, I think that your use of the stories of progress is a really good example of how we can have community engagement. There's not just examples from us as PAN in the health professional sector, but in many different sectors. So we hope that that resource will help you and guide you and provide inspiration. I have a quick question for Sumati. On the nutrition side, so we have a question from Ursula. Should Planetary Health Diet guidance more clearly support use of fortified foods and or supplements? Some micronutrients, for example, B12, iron, omega-3. What can you share with us about the Planetary Health Diet recommendations for those individual micronutrients?
I think I would like to start by saying that one, nutritional deficiencies diet is not the only leading cause for the deficiencies. So it's not just diets and supplements that would come into play to address nutritional deficiency as such, but also other public health interventions. In terms of focusing more on fortified foods, fortified products, supplements, I mean, the the key message that goes here is diet is central, and then based on individual needs of, for example, which dietary preference you're following. Is it very low, or is animal food absent completely? If it's a vegan diet, then as we discussed, vitamin B12 would not be present, and that is where you could have supplements or fortified foods. So the recommendations for anything apart from the diet are very individual based. And that's why we do not completely explicitly say we need to be having these fortified foods or supplements. So those come as actions with when you tailor the PhD to your individual needs and to population needs. Walter, would you like to add anything?
Yeah, I think that's a good comment. That basically, if for your person, if you're a person without specific needs, the average healthy adult person, and even across the lifespan, we did consider children and pregnant lactating women in the report. That if someone is following pretty closely the target numbers there I think really shouldn't be a need for fortified foods or supplements, but some people may need some extra iron, for example, premenopausal women, just because of menstrual losses, need some extra iron. For most of them, this will still be okay, but that's something that does need monitoring in a population. For example, we say whole grains, but the reality is not all whole grains are the same. Some of them are loaded with iron, some of them less. And so we did emphasize that regions and countries should be doing their own nutritional surveillance to see if there are issues there within their populations and given the specific food sources that they have available. For pregnant and lactating women, the WHO does recommend supplements already and has for years and years. There's a lot of evidence that should be more than iron and folate, and general micronutrient supplement has added benefits. Almost for sure, very shortly, that will be the recommendation. So this does need to be considered again in a regional and national level. Iron is really complicated, but even the U.S., with all this red meat consumption, still has a fairly high prevalence of iron deficiency. And a lot of this in some places is due to infection, chronic inflammation, other things, not just not getting enough through the diet.
Thank you so much. We've actually reached the end of our hour, and even though there are still some questions in the chat, we're going to have to wrap it up over here. We will save all of your questions though, and if you do have any additional burning questions, we would love to receive them. I think we've posted our emails a couple times in the chat. Otherwise, I just want to remind everyone that even though the paper is now published and we have hosted this single briefing session, the work is not over now or at the end of the webinar, that we still have a lot of work to do together. And this is just the beginning of that journey. So if you are passionate about the planetary health diet and advancing it in your unique context, where you are in the health system and where you are in the world, please do join our community for action for health professionals. You can find the fact sheet on Panko. You do have to register for free. And then you can continue the conversation, post your questions there, and answer all of our polls about the planetary health diet. So Professor Willett, Roberta, Sumati, thank you so much for joining us today, all 200 of us from around the world. And good luck with the rest of your day and with your next steps on the planetary health diet. Thank you very much.